Agnieszka Sekula. So Agnieszka is a scientist with a background in biomedical engineering and medical imaging. She used cutting-edge biotech tools, including customized imaging robots, 3D modeling, and VR to innovate medical research all over the world, including forensic medicine in Switzerland, space medicine in Austria, and translational science in Singapore. She is currently a PhD candidate at the Center for Human Psychopharmacology at Swinburne University in Australia. Agnieszka is devoted to science outreach, extensively advocating for open science communication, community-led research, and outcome transparency. For her outreach efforts, she won the Best Speaker Award at 3D Med Australia and the MyLab's Image of the Year Award, amongst others. Her work has been displayed worldwide, including Shanghai Expo, Florence Biennial, or Sounds of Space exhibition in Austria. And so with that, I'd like to introduce Agnieszka to present virtual reality as a moderator of psychedelic-assisted psychotherapy. Thanks so much, Agnieszka. Please take it away.
Thank you, Leah. Just let me share my screen. Okay. Can you see my screen? All good? Great. So hello, my name is Agnieszka Sekula. I'm a researcher at Swinburne University, where we investigate the role of experience design in optimizing psychedelic-assisted psychotherapy in order to improve treatment outcomes. I'm also the co-founder of Innovate Therapeutics, an Australian research and development company, where we translate the findings of our research into real-life application. And we do that by developing virtual reality scenarios. In my talk, I will explain why do we need to focus more on experience design in the clinical application of psychedelics. And then I will present our research on how experience design can be used to moderate the entire psychedelic psychotherapy process and what makes VR a particularly good candidate for that purpose. I'm sure most of you are familiar with this diagram. Unlike most other psychotherapeutic frameworks, which follow a rather linear progress, in psychedelic psychotherapy, the therapeutic sessions are centered around the dosing session. First, we prepare clients for what is to happen during dosing, and then we try to reconnect with and integrate what emerged from that dosing session. And the reason for that is the recognition that at the center of the psychedelic-based healing, both traditionally and to a large degree in current clinical models, are the experiential, embodied, emotional aspects of the subjective altered state experience. However, if any of you had a mystical experience or altered state experience, you know that although it's one of the most vivid and profound experiences you may have, it is very difficult to do it justice in communicating about it. In fact, one of the key characteristics that are used to define an altered state of consciousness is the fact that it's ineffable. Those transcendental sensations and the immense amount of thoughts, emotions, sensory perceptions need to be reduced to something that's more manageable if they are to be expressed with language. That information is then made even more abstract by the interpretation of a therapist who has not experienced what you have experienced. And to make it worse, those insights quite quickly become less apparent, and often even the next day after dosing, a lot of that information is lost. Which is why my colleagues and I believe that current clinical framework is not doing the psychedelic experience justice. While the psychedelic experience is strongly emotional and embodied, the methods of preparing for it and then integrating it are predominantly based on talk therapy, which is much more a cognitive and analytical process. So it feels like we stumbled upon this incredible, novel, and to some degree mysterious treatment mechanism. And what we do is try to fit it into pre-existing psychotherapeutic frameworks which have been developed with a very different approach in mind. So one of our main research questions is, how do we refocus psychedelic treatment on the emotional, embodied, experiential moments of the psychedelic experience? And we actually see technology as a way of reconnecting with and once again prioritizing the immersive experience over the therapeutic framework. In this way, technology can bring us closer to the traditional approaches rather than further departing from those traditional models, which is what I think a lot of people worry about when we speak about bringing modern technology into psychedelic science. This is the paper we published earlier this year, which goes into depth on different properties of VR that make it a promising candidate to support and moderate psychedelic treatment, as well as what are the main limitations, side effects, and the most necessary next steps in exploring, evaluating, and then validating this approach. Instead of going through those in a way you can read them in a paper, I will reframe those features and present how can we make the most out of them through specific applications of VR in different phases of treatment. I will also tell you a little bit about what type of VR scenarios this research has led to, and then present the preliminary results from our recent case studies. So one of the main functions of the preparation phase or preparation sessions is to prepare clients for what the psychedelic experience may feel like. This is to ease any fear or anxiety they may have around it, and to train them to surrender deeper into that state so they can remain open and curious about it. It seems that the best way to prepare for what an experience feels like is by simply experiencing something similar. Research shows that the ability to achieve and surrender into an altered state of consciousness can be trained, and that practicing it can lead to an increased capacity to enter an altered state and to make the most out of it. It also seems that the skill to enter an altered state is translatable across different methods of inducing an altered state. So for example, the more experience you have with inducing an altered state with meditation, the more likely you are to experience ego dissolution and have a stronger mystical experience induced with psilocybin. A more real-life application of this is exploited by high-performing teams, for example, the American Navy SEALs, who induce diverse altered states methods in their training, for example, by using sensory deprivation tanks, gravity swings, or trance, in order to then increase their ability to enter a different type of altered states during mission, the so-called state of flow, or as they refer to it, the merging of the consciousness of the group. VR has been recognized for its potential in expanding consciousness already by the early proponents of this technology, including Timothy Leary or Terence McKenna, who refer to it as a tool for going beyond the reality horizon. VR, in fact, has been developed in order to expand consciousness and not to create gaming environments or educational platforms. And luckily, empirical research has finally caught up with this, and VR has been shown to be capable of evoking altered states in a way that doesn't require as much predisposition as, for example, meditation or hypnosis, which might be very difficult for some of us. So in this way, VR can be used to prepare patients for what an altered state experience feels like, to train their ability to surrender to it and to feel more open to it before they're exposed to a psychedelic substance. During the dosing session, one of the most important things or the best things that we can do for our clients who are about to embark on this big psychedelic journey is to encourage a sense of safety, openness, and mindful presence. Mindful presence shortly before and when entering an altered state helps patients to mitigate anxiety and to stay focused on their intention for the experience, which in turn leads to better therapeutic outcomes. Meditation is very good at supporting mindful presence. However, as I mentioned, it might be difficult to obtain on its own and often requires very lengthy practice, and the current psychedelic psychotherapy models cannot afford. On the contrary, VR makes the deep mindful state more accessible in a shorter period of time, leading to the depth of mindful presence that does not seem to be reached with other meditation methods that are supported with other tools. And perhaps most importantly, VR is particularly successful at evoking an immediate mindful state in situations that are acutely stressful, which the psychedelic experience often is for a lot of us. So in this way, VR can be used at the beginning of the dosing session, shortly before or shortly after dosing, or both, to assist with the difficult task of reducing external distractions and then maintaining the attention on intention going into the journey. Lastly, we all know that the depth or the intensity of a mystical experience seems to be correlated with the impact that the psychedelic session has on the client and on the therapeutic outcomes following psychedelic psychotherapy. Combining different state-altering practices at the same time seems to lead to an augmented cumulative effect in producing a deeper altered state or a deeper psychedelic experience. This has been explored in research, for example, the use of LSD and deprivation tanks by John Lilly, or by combining psilocybin and meditation, as I mentioned before. This cumulative effect has been known in traditional settings where the psychedelic substance is very often accompanied by a form of shamanic practice or a ritual, for example, a trance dance. VR and psychedelics share a number of state-altering mechanisms that can be explored for their synergistic application. These include disconnection from space, from time, and even one's body. And it also includes evoking a particular state of awe. Awe can be evoked in a number of ways, for example, through aesthetic arrest by looking at a beautiful landscape, leading to the so-called quick-boiled awe. But there are very few ways in which the slow simmer awe can be evoked. The slow simmer awe is a more profound, destabilizing sense of awe that leads to substantial expansion of awareness and the need to accommodate of the vast sensory stimuli, which can be destabilizing initially, but then leads to a phase shift in the state of mind. Both psychedelics and VR scenarios, especially ones that represent unfamiliar, fantastical environments, such as deep space, have been shown to evoke that phase-shifting type of awe. So in such way, a simultaneous application of VR can be used to augment the peak psychedelic experience. And just to make this clear, we do not mean augmenting the acute peak phase while it unfolds, but rather augmenting its impact by applying VR at the tail end of the psychedelic experience. In the time when the patient begins to return to normal consciousness, but is still very much under the influence of a psychedelic substance, and those emotional, psychological effects are still unfolding. It's during that time, the insights are still the most profound, but also very difficult to communicate face-to-face to another person. And in this way, VR offers another layer of reality, which serves as a transition zone between the altered and the normal consciousness, allowing patients to begin expressing their insights within the world that is still intimately their own, without needing to face the external reality. And using this process, we have developed a novel method of delivering VR into psychedelic psychotherapy, which allows patients to start forming the first narrative in the way that is more emotional and embodied through a multisensory expression. Those multisensory expressions become anchors of the profound, raw psychedelic insights, which can then be revisited during the process of integration. This is a representation of an anchoring VR scenario developed by Enosis, where patients who are at the end of their psychedelic experience select or create visual expressions of their own experience and then fuel them with audio recordings of their insights. Those insights, represented with stars, are then formed into constellations to serve as a personal memory library or a memory palace, if you're familiar with this term, of that psychedelic experience. The integration process is initially based on being actively reminded of those insights through your own audio and visual expressions, and then passively reminded through the immersion in that fantastical scenario that becomes associated with the psychedelic experience. Then further integration is based on exploring those constellations, structuring them, identifying common themes, or putting them into different actions. We have recently put this VR scenario and our VR modulated psychedelic psychotherapy protocol to test during an individual 2-day psychedelic retreat in the Netherlands. This was the world's first ever VR and psychedelic study, and was performed in collaboration between Agnieszka Therapeutics, Swinburne University, and Psychedelic Society Belgium. We have recruited 4 healthy volunteers who received a single therapeutic dose of psilocybin-containing truffles and our anchoring VR model. VR was administered at the tail end of the psychedelic session at the participant request, so around 4 to 5 hours post-dosing. And the duration was dependent on the participant. The VR scenario has no fixed timing, and the average observed time of use was around 40 to 45 minutes. Then the next day, the participants were first exposed to the control VR scenario, which will serve as a control for our quantitative data, and then experienced the same anchoring VR model, which contained their recordings from the previous session to aid the process of integration. The measures we took were, the main measures were the state mindfulness scale, in which participants rate the level of relevance of items such as, I felt aware of what was happening inside of me, or I noticed pleasant and unpleasant emotions. And the VR-induced affect checklist, where participants rate the intensity of the current emotional state with items such as filled with wonder, moved, agitated, calm. Unfortunately, the data isn't peer-reviewed yet, so we cannot share the quantitative results with you at the moment. But what we can share is the subjective reports that were provided by the participants at the very end of the retreat. And here are some of the quotes that were provided by the participants, and I'll give you a little bit of time to read through them. My favorite one is VR helped me to reflect on the experience. It kept the marvel. You're not tripping anymore, but you are reminded by this magic vision. And I hope it's clear from those quotes that the participants were both reminded at a psychological level of what they've said, but were also brought back into that immersive environment that reconnected them back with their experience. So in the process I described, the therapeutic engagement was developed and centered around the altered state experience and not around the talk therapy framework. I've spoken about experience design with the use of VR and how it can be used to promote the emotional embodied moments of the psychedelic experience, which we believe to be at the very core or one of the core features of the psychedelic-based treatment. There are also other aspects of psychedelic psychotherapy that we believe require more attention at this point, and that we think technology can provide assistance with. 2 of them that I will outline briefly are the empowerment, which is ensuring that patients are the ones in control of their own healing pathway, and permanence, offering therapeutic frameworks that are developed with a long-term approach in mind, and which then encourage the ongoing process of self-healing. So let's look at the empowerment. VR is reportedly one of the most comfortable forms of therapy. It is especially effective in creating a sense of comfort and safety among the most traumatized or the most apprehensive patients. The review by Maple-Scala reported that out of 350 soldiers who were involved in 9/11, 20% who refused to talk to counselor about their mental health were willing to try VR or to use VR for their mental health treatment. Similarly, Garcia study showed that among patients with specific phobias, the refusal rate for regular treatment was nearly 30%, but for the VR treatment was only 3%. And this sense of comfort might be why therapies that involve VR are reported to have higher therapeutic alliance and satisfaction rates when compared with various other counseling methods. Another important factor in therapy is the patient-therapist dynamic and the sense of hierarchy that can be induced in the dynamic. If you consider most forms of therapy, they either take place at a clinic or a hospital or a therapist's office. It is distinctly the space that belongs to the therapist, where the patient is the visitor with very limited level of control over their environment. Unlike the therapist's office, the virtual world can belong to the patient. It can be owned by the patient with all its elements being under their full control. And the therapist can be invited into that space, but he doesn't have to be. So it is the therapist who then becomes the guest. Secondly, if you consider the impact that the physical environment has on the nature of the psychedelic experience, being able to choose and to modulate that setting freely can give patients a sense of agency over their healing. VR allows a full range of stimuli control. We can, of course, select from an entire range of stimuli that can be projected on the patient. But just as importantly, we can use VR to buffer from the distracting or the unwanted stimuli. This is particularly important, for example, if the physical presence of the therapist feels intrusive, or if there are domestic elements of the room, like the bed or the chair, tether the patient to the familiar reality. It makes it more difficult for them to surrender into the mystical experience. And as used in our anchoring model, VR also allows an unlimited multisensory expression and can serve as a canvas for the patient in the process of a communication that is non-verbal. The last element of experience design I want to explore is the sense of permanence. We need to find a way to enable a sense of permanence in treatment right from the onset. So that the client can feel assured that the process of healing will continue for as long as they need that. The sense of permanence has been threatened by the lack of cohesion in psychedelic treatment as it moved from the traditional setting into clinics. In the traditional or the retreat settings, the model is much more unified, with the entire therapeutic process often taking place in the same space, with the same people, in a very continuous manner. And the clinical models obviously struggle to maintain this framework, and the treatment is separated very distinctly into 3 different phases, with the talk therapy in the preparation integration phase, often taking place in a different space, with different tools, sometimes even different people when you compare it to the dosing session. And then the sessions are further disjointed by usually taking place on a weekly basis. So patients may struggle to leave their daily lives behind in order to immerse themselves in an altered state focused therapy or recall their insights that quite literally belong to a very different world. On the other hand, using immersive VR environments can help to ground patients when they arrive to therapy and can help to detach them and buffer them from their daily lives. Most importantly, VR scenarios can be ongoingly developed together with the patient. So starting from the very first session, all the way through all the sessions of therapy in order to offer that sense of cohesion in treatment. And then this sense of cohesion can be maintained even when the formal integration process concludes through the process of self-practice. In our work, we aim to provide patients with models they've created during formal integration, either as a VR scenario or a 360 model, depending on their access to tech. So they can have unlimited therapeutic trajectory that they keep following at their own pace. And given that VR treatment has one of the highest adherence rates, in fact, using VR as an adjunct increases adherence to other forms of treatment, we expect that clients are likely to continue the process of integration and that self-paced healing using the VR tool. Obviously, like any tech and any treatment, VR can be highly beneficial or it can be disastrous, depending on how we use it. That's why introducing VR into an altered state therapy requires not only a lot of care, but also an evidence-based, research-first approach, and needs to be driven by validated clinical outcomes and not by commercial interests. From what we've seen so far, VR as a moderator of psychedelic psychotherapy does not actually acquire elaborate scenarios or impressive visuals, but should rather offer targeted, simple functions that support and not overtake the psychedelic healing. In order to mitigate any potential side effects, any VR stimulus needs to be first tested for the risk of inducing cybersickness, overstimulation, or accidental exposure with triggers that might be traumatic for some clients. VR scenarios also have to be designed very carefully to avoid distracting from the experience or leading its content. I think this is something that a lot of researchers in this space struggle to conceptualize, and they worry about that leading or distraction from the actual psychedelic experience. So in our approach, we say that less is more, and our models are more focused on functionality than only perceptual content, which we actually find unnecessary and almost trivial in the face of that complex imagery that is experienced with the psychedelics. Lastly, there are, of course, a lot of technical limitations, like the need for additional training, because therapists need to be very well versed in the use of VR for the therapy to go smoothly, as well as physical comfort that require a lot of, or a well thought out setup of the equipment and the space in the room. So to sum up, we believe that in order to maximize the benefits of psychedelic psychotherapy, we need to approach it not only from the clinical perspective, but also from the experience design perspective. And broadly speaking, experience design relates to how we engage with the psychedelic experience, to the totality of what this means. It includes, but obviously goes far beyond verbal communication or the exchange with the therapist. It covers the physical environment, the tools, the people who are present, but also all the processes and practices used to both prepare for the experience and to integrate it afterwards. So for example, whether you meditate or go for a walk in nature or reach out to someone to help you navigate your insights, this all defines the experience design. And lastly, and perhaps most importantly, experience design puts those subjective altered state of consciousness experiences at the center of the therapeutic framework. And it puts the client at the center of treatment. So we are, of course, not the first ones to believe in the importance of experience design. Experience design, if you haven't already realized, is strongly rooted in context. Here are a couple of quotes from Robin, who's one of the scientists that pay increasingly more attention to the importance of context in psychedelic treatment, and I'm sure you're quite familiar with those quotes. So the main message I'd like you to take away from this is that we should prioritize the unique aspects of the psychedelic treatment instead of trying to fit it into pre-existing frameworks. We truly believe that psychedelics have a chance to shift how we think about mental health treatment and also mental health being or mental well-being in general. And we shouldn't shy away from that because we need a real tangible phase shift. A big thank you to our advisory board who offered tremendous amount of support and help on this journey. And if you have any questions, feel free to reach out or visit our website at analysistherapeutics.com. Thank you.
All right, thank you so much for your presentation. Am I good to do the Q&A now? All right, so let's start with Alice because they've got their hand raised, and then I'll go through some of the chat questions and some of the DM questions.
Hi, can you hear me?
Yeah.
Yeah.
Okay, great presentation. Thank you so much. I was really curious about the design portion of it. So how do you go about deciding on a design? How do you find out what is most effective or what was most effective design wise? And then also how do you customize it and tailor it to each individual? Or you know, are there certain designs that just, you know, one size fits all?
That's a really good question. So first of all, it took probably around 2 to 3 years of just pure research before we did a single 3D object. And that was both, you know, there isn't any research in this space. There isn't any research showing how VR and psychedelics could work together. So a lot of this was going with what we know about psychedelic treatment, what we know about VR as an immersive or state-altering tool, and how can we use the two to make the most out of this combination. We've had a lot of discussions with anyone we could find in this space who has any experience either with VR or with psychedelics. And some of them became our advisory board members. Some of them gave us a lot of feedback on our initial ideas. So it was a very long process of coming up with those conceptual foundations and then reiterating. And so once we've had sort of basic concept of what we want to start with, we would develop it and then we would show it to anyone who was interested, including therapists who work in this space or including anyone who has extensive experience with psychedelics to give us their feedback. And so it was a very, or it still is, a very time-consuming process because in a way we validate every single decision that we make. So we would never design a scenario and then have a full scenario and then run a clinical trial. We basically go through reiteration of our designs on a monthly basis, if not more often. And in terms of what goes into that and the level of personalization, so one of the scenarios that I showed you is far more a canvas for the participant to build on or project onto than it is something that we build for them and project on them. So we create a very simple space where they can feel immersed in the environment that is congruent with their experience, and then the rest of it is up to them in a way. We provide certain elements that they can play with that are quite basic and very, very subtle, because we found that we really don't need to provide a lot of stimuli for someone who's just been through a psychedelic experience. So the visuals and all the effects are very, very simple, very subtle, and it's up to the participant to kind of construct it for themselves from the inside out, if that makes sense.
Yeah, thank you so much. I actually had a lot of questions of my own that were along the same lines, so that answered a lot for me. We've got a question in the chat that I also really like from Kiro. Does the external attentional orientation of VR affect the internal orientation and exploration that is often believed to produce those noetic mystical experiences and insights?
The external orientation of VR?
So I guess the question is about, like, would the stimulus from the VR that is something external draw away from what's sometimes emphasized during psychedelic experience, like wearing blindfolds and cutting out those stimuli?
Yeah, that's right. So the reason why we decided to use VR is because we believe that blindfolds are a bit limiting in a way that they're very binary. So if you have blindfolds, you're either completely cut away from all these sensory stimuli, and then when you take them off, you're completely immersed in the full environment that is very much representing your sort of your daily life. And as much as there is a lot of work that goes into setting up a beautiful room, it is still a room. It is a room in a clinic. There's still a bed, a chair, painting, a plant. And so VR kind of allows us to dose that stimuli in a much more subtle way than through the external environment. So in a way, we're not really replacing any of the moments that are spent wearing the blindfolds. If anything, we're replacing the moments that are spent within the room that has much more distracting or external stimuli than what we have in VR. So in that sense, VR is much less distracting than the room that you're in. Yeah.
That's a really interesting point to create that in between. I like that.
Thank you.
Another question about VR specifically. So how do you feel about the current technological state of VR? And do you think that there's still a ways to go in terms of it feeling more immersive or maybe more real? And as a follow-up to that, yeah, go ahead, answer that first. I'll ask the second part.
Yeah, oh, absolutely. And it will keep improving. We know it will. There is obviously the question of how much do we want this to be immersive, and how much do we actually just need this to play a certain function? Because I feel like as long as it's improving the outcomes in the way we want them to be improved, that's a sufficient role that VR plays. And it will get better in terms of the interaction of it, in terms of the feel of it. For example, tactile components, which at the moment are very limited, will probably be developed in the next few years, that will make that sense of connection with your insights, or whether you produce your insights or somehow interact with them within that VR environment, it will make it much more immersive and much more connected. So in that sense, yeah, there's a lot of options that will pop up in the near future that we'll be able to explore. I think actually that's not a very exciting maybe improvement that I'm hoping for the most, but I'm really looking forward to VR headsets becoming more comfortable and physically less heavy, because that's something that we're actually facing as a problem. And that's why the room and the space has to be very well set up for the participant to be very comfortable, because the last thing we want to do is put something heavy on their head for an hour. And that is a limiting factor for us at the moment. But it will definitely happen in the next few years. So yeah, we're looking forward to that.
Yeah, and I'd say that you also answered the second part just about whether this factor of being immersive or real is important in use of therapy. And I've got this other really interesting question. So as much as I guess you're able to share from the trial, have there been any challenges with participants and have their experience not feeling sort of aligned with the VR structures that were developed for the trial?
There were about 100 challenges, but more for us than for the participants. There was, so initially, that was the very first time we've tried this. And for us, the main challenges were on the technical aspect of things and making things run smoothly. And so that's why we know that it does require a lot of preparation, a lot of trial and error, because it does have to run completely smoothly. There can be no hiccups in that. And so these were actually the main challenges that we experienced with the first participant. With the others, we've already kind of learned from that. But in terms of, for example, the emotional challenge or sort of, the challenge of having to go through VR, we haven't really experienced any negative feedback in that sense. In fact, we were in the protocol that we designed a 20 minutes VR use, especially for that, tail end part of the experience. So the first application of VR. And as I said, we saw the average time of use was around 40-45 minutes. So participants were actually quite keen to stay in it. And I do believe that partially it is because it's such a such a subtle stimulus, and it's not overbearing in any way. So it's possible for them to stay in that. If we had any intense visuals, I believe we would really run into a lot of problems. And this is something that requires a lot of care, especially if there's, there are models coming out from VR companies that specialize in beautiful visuals, but they can be very overbearing for someone who's about to have a psychedelic experience or who's just had a psychedelic experience.
Yeah, that's really interesting. It sounds like you've done a good job of like researching the background and developing something that works widely. So I'm going to do a final comment from Kelly. And she says, from a standpoint of working in clinical trials, one of the difficulties of working in psychedelic-assisted therapy is that the participant must stay in the room during the entire experience. So I can imagine that designing a room that looks similar to the treatment room, then allowing the participant to explore beyond that room via VR with an ability to come back as an anchor would be very helpful. So I guess just asking if you've ever looked into doing something like that.
Interesting. It's we're trying to, or in our approach, we're trying to move away from using VR as a replica of something that exists in reality, because we know that we can never come anywhere close to building something that looks as real and as tangible as, for example, the therapist's room. So we try to use those properties of VR that are very unique to VR only, and are kind of pushing those boundaries of perception and interaction with our aspects of our perception. But I completely see, how there are other applications of that might be much more immediately kind of applicable as well, for a lot of therapists who want to explore specific type of uses and having that capacity or that freedom of then leaving the room and going into nature, sitting outside and having that VR headset that kind of maybe tricks you into believing that you're outside, is a potential. I'm not sure whether at this point in time there would be any actually tricking the person to think that they're leaving the room, because I don't think we're there in terms of the immersion in the VR environment. And I don't know whether that combination with psychedelics would actually work as well as we might think, in terms of tricking the brain into thinking certain things that aren't real. So it would still feel probably like they are in the VR environment, they just have more access to other spaces that are more explorative and more interesting, and perhaps are better setting, physically a better setting, to what they're going through with psychedelics.
Yeah, thank you so much. That's all the questions that we had today. Again, really awesome talk. I really enjoyed all the ideas that you presented. It's